everybody. Kate Grace, host of Move Without Limits podcast. And I'm so excited today for you to meet Dr. Davis Francis. We are going to talk about what everybody's talking about, peptides. Why are we talking about peptides? Because I've talked to people for the last year about this, and most of the people I've talked to are not using them properly, or they're taking peptides they think are peptides, but they're actually a bunch of vitamins in a bottle. And I have researched, I think for maybe over a year now, trying to find a reputable, honest, a lot of integrity, smart, treats patients well with the right thing. And I finally found someone in Laguna Beach, California. And we're going to debunk the myths. We're going to tell the truth about peptides and a lot of other things. So without further ado, I want to bring in Dr. Davis Francis. Hi there.
Hello, everyone. Hi, Kate. Thank you so
Hi.
much for having me on.
Well, I'm so grateful you're taking time out of your busy clinic day to talk to us. And this is a topic that so many people need to understand, have a good understanding of. So I'm going to mention your education just because in my research, you are a naturopathic doctor.
Naturopathic medical doctor, yeah.
Naturopathic medical doctor, went to Bastyr University in San Diego. Did you go to that one?
Yes,
Yeah.
that's
And
it's go ahead. Sorry.
we were my clinic in San Diego, we were very close to the people at Bastyr, and I really respected them, respected the education, respected what they were doing. And if you could talk a little about your education and what you had to do, and please mention that there are places where people don't have to get an accreditation or pass an exam or have to get CEUs, right? In some states.
Yeah, absolutely. And I think that this is where things can kind of get a little bit interesting, we'll say, in the holistic medical space. But there absolutely are licensed doctors and physicians within naturopathic medicine that are accredited, right? And different from your, naturopath or your homeopath, right? Um, the naturopathic medical doctor, they go through 4 years of medical school, just like every other doctor, and then have a residency afterwards. So the way that I like to tell people a lot, if you want to become a doctor in the United States of America, there's three pathways that you can take, right? Allopathic, which is your MD, osteopathic, which is your DO, and naturopathic, which is your ND. Depending on what state you're in or what state I'm in, I can call myself a physician or a doctor. California is a little bit more stringent. So in this state, I have mid-level practitioner um, rights. So I can do a lot of things. I can prescribe medications, work with these peptides. I work a lot with regenerative medicine, hormones, gut health, functional wellness.
Okay, great. Well, you certainly are accredited. So would you talk a little bit about your practice and the kind of patients you see, and then we'll talk about various treatments?
Yeah, absolutely. So my practice is called Ashara Health and Wellness. We're located in Laguna Beach, California. Um, what we do here is really naturopathic functional medicine at its core. Every time we engage a patient, typically, we'll take them through a detox protocol first, but it's just so important to start with the foundations, right? When someone comes in, we do a very thorough intake. Our visits are usually, sometimes up to 2 hours, where we do a really thorough deep dive into the foundations of health, right? Sleep, diet, exercise, relationships, stress, water sources, all of these things that I think are very often put on the back burner or maybe not even thought of as part of your health journey, right? But absolutely, when you can get the foundation right and strong, the house that you build upon that will be much more sound than if you didn't do that kind of tedious lifestyle alterations off the jump.
That I love that you say that you kind of start with the low hanging fruit and talk to
Very
people
much so.
about all the things that are important and they can do, and then we'll only put them in better position to whatever treatment you prescribe,
Exactly.
right?
It works out
Um,
better for everyone.
I mentioned that we are going to answer the age-old question that everybody wants to know now, whether the peptide, but I also just want to tell people I know there's so many scam people, so many scam companies, multi-level marketing, people selling a supplement that on a peptide. So, Davis, what is a peptide?
Yeah, absolutely. That's a great question. So, a peptide is quite simply a chain of amino acids. And a chain of amino acids, depending on what order that chain is built upon and to what number, will completely dictate function. Right? Some peptides will be destined to be a nutrient, some will be a cofactor, some will join up with other peptides to form a protein and then serve a function, right? So it really is one of those things where, depending on what peptide you're using, will absolutely determine what it's going to do in your body.
So these are naturally occurring in the body, right?
Yes. Yep.
But when they're formulated, I understand through a lot of my research, there's natural and there's synthetic. I think a lot are taken from mammals, right? Or porcine, or um,
Sources.
their
y-
sources for making this synthetic. Yeah.
Absolutely, and that's where, peptide medicine is still in its infancy, right? We're still you and I can it kinda goes into the next questions of, like, where do you get them? Like, what qualifies a laboratory as a good source of these peptides? But you're right, these are naturally occurring peptides that are produced in a laboratory to create these very high elevated concentrations that we then extract and then put into the body. A lot of the times the sources are not human. It is possible that you can be deriving something from a bovine source, for example.
Okay. So give us an example of what you treat a condition or what you treat successfully with peptides, and maybe talk about there's many different peptides, right, that are better for certain things.
Yeah, absolutely. There is so many peptides, and that's why I think working with a licensed medical practitioner is so helpful, because then there's just so much noise, right? How do you sift through the noise and find what actually is going to be best for your personal individual needs? Um, so I'm so sorry. Okay, will you repeat
Oh,
that question?
so I know you and I talked, I know it's great for gut health
Oh yeah.
or maybe skin problems, or what do you treat and what peptide do you use for that successfully in your practice?
Absolutely. Let's start with I think the one that more people know about, which is BPC 157. This peptide is a 15 long amino acid chain that then will go into the body and do a bunch of really cool things depending on how you're using it, right? So most people, how they're taking peptides is through subcutaneous method, right?
Mhm.
So depending on if you inject it in a sub-Q, route, or if you're doing something more intra-articular or more local, I think we'll say, is going to dictate what types of cellular pathways are going to be activated, and to what extent. So for BPC 157, there's so many good applications for it. I've had really tremendous success with gut inflammation, things like that. And a big reason as to why BPC or KPV is another good one for the gut, what they do is they act on these cellular pathways that are going to, one, increase perfusion of blood, right? So they're going to dilate blood vessels through upregulation of nitric oxide, um, and they're going to downregulate certain pro-inflammatory cytokines, right? So now inflammation is going down, blood flow is improving, and then to some extent they're going to upregulate certain other cellular pathways that are going to strengthen the integrity of tissues. So if you're taking something systemically like BPC 157 or KPV or a mix of the two, these peptides, something to keep in mind too is that they have a half-life, right? And BPC 157 particularly has a half-life of 1 to 3 hours, right? So
Hmm.
you have a 1 to 3 hour window following injection for you to be able to anticipate some sort of results from the injection. So if you're taking it in the gut sense, typically what I'll tell patients to do is, take this in a fasted state before bed, right? before we go to bed, when we're asleep, right, we're in parasympathetic mode. The body's in more of a rest and digest, repair mode. Pathways are more leading towards that end. So when you supplement it with the BPC 157 or the KPV, you're providing the tissues with the necessary components it needs to activate those cellular pathways to strengthen itself, right?
Hmm.
Now, in a joint sense, using the same peptide, BPC 157, it's still going to do all of those, or a local sense, I'm sorry, a local injection. Let's say you got a bum knee, right? So we might put some BPC 157 into that joint. Similar effects are going to happen, right? Angiogenesis, VEGF, or those pathways are going to increase. Blood flow, capillaries that were maybe senescent, they're getting old, they're not, fully working like they used to, are going to get a boost, right? And when it comes down to it, what we're doing in that's in sense of the oxygen in the blood vessels is we're bringing oxygen, right? And when you have inflammation, one of the things that's spent is oxygen. So that in itself helps improve the picture. Again, we're down regulating those pro-inflammatory cytokines. We may upregulate certain things like growth hormone in a local sense to stimulate things like regeneration in the tissues, etc. So what I'm getting at here is like these peptides, depending on what receptors they hit and what peptide you're using, is going to determine, how effective that is going to be. And timing these things and being aware of the timings are also really important.
So you said that this lasts 1 to 3 hours. So is that like all the benefit the patient's going to get?
Not necessarily. Those pathways that are upregulated or downregulated, they're gonna follow through, right? So they're gonna continue until they reach their end goal, which for a pro-inflammatory cytokine downregulation would be just that. So there
Okay.
will be longer term effects, but let's go back to the knee thing, right? You take the BPC 157 injection and you have a good result. It feels better, see it all the time. And let's say then you decided to go golfing and you walked 5, 10 miles, right? And then you basically improve the or increase the inflammatory situation, right? So in that sense, yeah, then you might need another dose.
Okay. Do patients generally multiple doses or how often, and can they do this themselves? I know you mentioned the best
Yeah,
way is
that
sub-Q,
is
so
the way that it's typically done is for yourself, just based on regulation with the FDA and what stance they have on specific peptides. Um, but it's hard to say. I come from the perspective of it's a little bit of everything, and everyone's different.
mm,
So I've
mm,
had tremendous success with patients where 1 or 2 shots is all it took, and they're good.
mm.
Granted, in those 1 or 2 shots, we're using a high concentration or a high dose, right? But I have other patients who maybe have some more chronic issues that they'll take systemically. They'll do 5 days on, 2 days off of an adequate dose, depending on what peptide we're talking about. We'll speak of Wolverine for a second. You may
Okay.
take that systemically and get this tremendous benefit for systemic inflammation. I have elderly patients that will take it and just feel stronger. There's just this improvement in the body's integrity that occurs when it has the opportunity to repair and not be managing a high inflammatory load.
So you mentioned Wolverine, so to people who don't know, I
Yeah,
think that's a combination of peptide,
mhm.
right? Can you describe what that is?
Yeah, it's definitely a street name, I'd say. Uh, what
Not
my
a movie.
understanding yeah. My understanding of it is it's BPC 157 to the largest degree, but then also something like TB 500, TB4. My Wolverine pack has BPC 157, KPV, and TB4.
Okay. So I know that there's peptides. I know bioregulators. I'm not sure if these are bioregulators, but I know that there's like a one for the thymus gland and to help with
Yes.
this, and one for the thyroid, and one for all these different organs. Um, do you? I know. I think one's called alpha something.
Thymosin alpha 1,
Thymosin alpha 1, and is there a thymosin
thymosin
beta
beta 4.
4?
Mhm.
And do you use those, and what do they do?
Yes, absolutely. I think those are so TB4, thymosin beta 4 is derivative, or you could say the other way around, of TB 500. So they have very similar mechanisms. And what that specific peptide has been shown to be very useful for is more in tissue regeneration. Um, it's going to improve things in like the endothelium, fibroblasts, things like that. It's well paired with the Wolverine because in a way that they're acting towards the same goal, which is improve structural integrity of the cells. Thymosin alpha 1, this one's a little bit different. This one I would say we're using to improve the immune system, right? To give it better ability to manage and be useful. It's going to act on things like dendritic cells and macrophages, improve T cells. And this one's actually a really interesting one too. Thymosin alpha 1 is similar to BPC 157 in a way of like they're both going to act as messengers, you could think of. They're going to go and interact with the cell. And typically these are the immune cells, right? So it's going to go and interact with, let's say, a macrophage. And a macrophage is going to be upregulating certain cellular pathways within itself, which will likely lead to something like increase of hydrogen peroxide production so it can more effectively neutralize bacteria in the body. So TA1 is like kind of weaponizing your immune system to a large extent, but also increasing long-term production of something like T cells.
So, um, for the lay people out there,
Yes.
it's get a little scientific. So I know thymosin alpha 1, like you said, for the immune system, I think people use it for viral infections like Hep
Sure.
C, Hep B, right? COVID, maybe it would help with. And then I think the thymosin beta 4 is more for tissue repair and wound healing, would you
Yeah,
say?
exactly.
Okay.
That's right
Yeah.
on.
So I just want people to get that it's not one size fits all. They need to see somebody like you who can examine you properly, take a good history, and determine the best one for you. Since there's, I don't know, 20 or so more peptides and they may attack different organs.
There's so
Um,
many hundreds,
so it's got to
thousands.
be the right thing, right? Okay. So, because I've had people, I'm taking, 100 of these pills a day and I'm taking this for this and this for that and this for that. And so, speaking of that, I know I love the introduction via a subcutaneous injection. If you take a capsule or a pill, isn't it? Don't you get less of that absorbed in your body than you would through an injection?
Absolutely. Bioavailability is
Yeah.
so important because at the end of the day, dosing is an art, truly. Um,
Mm.
so when you take something orally, any kind of supplement, let's say it's 100 milligrams, you take a 100 milligram supplement, you'd be lucky, depending on your age, your digestive health, etc. But you'd be lucky if you get maybe 5 milligrams from that,
That's what
right?
I've
Yeah,
understood. Right.
it's significantly less. But the thing about oral supplementation is that consistency tends to be higher, right? It's way
Mm.
easier to pop a little capsule than to stick yourself with an insulin
Yeah.
needle.
Yeah.
But
Okay.
sub-Q shots, now we're getting into like maybe 50 to 75, 80%. And it's not 100 just because there's more time that there's more things that can happen in between injection into fat and then perfusion into the blood.
Okay.
Whereas muscle shots are more like 100%, 80 to 100. The muscle tissue is well vascularized. And then IV and anything into the vein is 100%
Yeah.
bioavailable. Mhm.
Okay. And I've had a lot of athletes ask me this because, our audience is, through
Yeah,
our joint effort and our class, we're attempting to help people get physically healthier, utilize their, resistance training for their musculoskeletal health, which is a non-negotiable, I think, over the age of 30. And
agreed.
I've had athletes ask me this, if they could take a peptide to enhance their performance, their recovery, anything like that. And if so, what would it be?
That is a wonderful question. And, I work with a lot of athletes myself, and I know that's part of the reason we connected. There's a few different peptides that come to my mind. One is the one we've been talking about this whole time, basically, is the Wolverine, BPC 157. And why this one's so effective for recovery is because it's bringing blood flow. This is a no-brainer, right? If you had the option to
Mhm.
get in a hyperbaric chamber following an intense exercise, you would do it for
Yeah.
obvious reasons, right?
Right.
You can think of this Wolverine peptide as kind of doing that, right? Not to the same extent, but it's increasing your body's ability to bring oxygen to any area, or if you're taking it systemically, your whole body. Right. So in that way, it's very good for recovery. The other benefits of it include the anti-inflammatory effects for obvious reasons. That's great.
Yeah.
And I get this sometimes too. Like, why would you want to cut inflammation, right? If you're trying to grow a muscle? And that's a great question. You don't. You don't want to cut it, but you don't want it to extend for longer than it has to. When inflammation arises, great. It did its thing. It brought the blood flow. It's bringing the nutrients. It's activating the immune system. Now we need to bring it down so we can work on healing,
You
right?
know, there's inflammation and there's inflammation, right? So you want to, and whenever you do this type of injection, you cause a little inflammation, but you don't want joint inflammation, like when your knee gets swollen, things like that. So I think
Right.
people have to understand the difference. And
Well,
what's also great about, I think my understanding is that some of these peptides, maybe the smaller ones, I think they can, through positive negative ions, I think they can get through the epithelium of the blood vessel, which is the outer lining, into the nucleus of the cell, stimulate the nucleus of the cell, which is the more stimulation of the nucleus of the cell, the better, right? And therefore enhance your blood flow. So, to ward off against cardiac problems or stroke problems, right? Am I right about that? Or it's that
absolutely. Like
somebody
it's gonna hit on, for example, BBC 157. I know it's just such a common one. I we'll
tell them
just
what
bring it back to
what
this.
BPC means, right? Body.
Body protection compound
Okay,
157.
everybody.
Yeah.
Body protection compound. There you go.
But this
Okay.
one would do what you're saying by upregulating the production of nitric oxide, right? So when nitric oxide is more readily available in the environment, blood vessels are going to dilate, right? And that's going to bring this oxygen in. But you're absolutely right. There are
Yeah,
some
love
peptides
that.
that will have a profound effect. A lot of them do in that their target cell has a change in gene expression, right? And by gene expression,
Yes.
I'm talking about protein production. Because at the
Yes.
end of the day, that's what our cells are doing a lot of the times, right? They're making proteins. We are protein,
Hmm.
right? So it's just helping it do its job better in a lot of senses.
Yeah.
And
I'm
that is one
so
of the
glad. I'm so glad you said that. I don't interrupt you, but I will lose
no,
my
you're fine.
train of thought. You're younger than I am. One of the things I have learned about, and you just mentioned about gene expression. So we want to enhance or maintain our DNA as long as possible, right? As we age. I know
Correct.
you're a lot of what you do is in anti-aging longevity. And I know
Yes.
the telomeres right at the bottom of the DNA
Yes.
shorten or contract or what as we age. So is there a peptide or bioregulator or something we can take that will help our DNA expression
Yeah.
or the
Telomere
telomere length
attrition
or
is what I would call it, right? Or telomeres, which are basically this nonsense AT, like chain at the end, that basically are saying it's over. You can stop now. But what happens is when we go through DNA replication, there's a cost, right? Nutrients are used, cofactors are used, etc. So a peptide that classically, and a lot of people have heard of this one for sure, which is NAD, right? NAD
yeah,
is one of those things that are used up in most cellular processes. Actually, ATP is the energy currency. So if you can increase the pool of NAD that's available to any cell, including cells that are responsible for DNA replication, they're going to be more efficient, right? So NAD at the end of its long-term goal is mitochondrial efficiency, production, right? Mitochondrial health. And there's pillars of aging, right? One of them being mitochondrial efficiency. So if you can handle your mitochondrial efficiency very well throughout your life through lifestyle behaviors, but maybe even supplementation, now you're leading to anti-aging long term. There's more energy available to all of your cells at any given moment, If you're 70 and you have an NAD level of, let's, speculate here, let's say 20, right? And then you supplement and you bring your NAD levels up to 80 for 4 months, your cells are going to respond in kind. They're
Yeah.
going to be performing in ways that they were not previously.
Yeah. And I know that you can, I don't know if you do this or not, but I've talked to people who have taken peptides successfully and their biological age may be 60, but when they go through whatever study they go through, their biological age is actually 50. And because internally they're in better shape, right?
Exactly.
Can that
Their
happen?
DNA is cleaner, we'll say. Not cleaner, but it's just being more properly handled.
Hmm.
And there another pillar you could say is your body's ability to make and fold and use proteins. And what we're talking about with peptides here is, in a way, protein. So as we age, we make less and less and less of certain proteins day in, day out. So when you supplement with these guys, you can uphold the integrity of certain tissues. Like, another really popular one that we haven't really spoke of is GHKCU, right? GHKCU is a peptide that people typically use for skin health, right?
Hmm.
And it's going to act on very specific cells like the fibroblasts, the skin cells, in a way that's going to uplift them and keep them at a more youthful state, right? It could help you reverse your age by having that nutrient more plentiful. But in the way that I like to look at a lot of these things, it's going to hold the line, right? It's going to help you maintain your cellular aging. And then when you do all the actual work, which is the diet, the sleep, the inflammatory insults, the toxic load, all of these things, when they're removed, now your body can thrive,
Hmm.
right?
Yeah,
So
for
just
sure.
bringing it back to those foundations,
Hmm.
before you want to start adding things into the situation, you want to put out the fire that's already existing.
Yeah,
Once you do
absolutely.
that, and peptides can be a great tool for that. Wolverine certainly is good for inflammation, but I
Mm.
don't like to use peptides as like, okay, that you came in, okay, here you go, right? There
Yeah.
really needs to be a lot of due diligence to accurately and precisely determine the dose and the type of peptide.
You mentioned skin. I'm glad you did, because I've had a couple people tell me, "Oh, I had, a facial and they put peptides on my skin." And I'm just not sure they did. Kind of like saying I put stem cells. If the stem cells that come out of you, they're not stem cells and they're in a bottle. So, do you ever like inject into the skin? Like people have skin problems, you inject right into their skin at the problem area?
Yes, all the time.
Okay.
Depending on what's going on is will determine what I put in the syringe. For scarring and things like that, you kind of said it, exosome stem cells, those are great just because they when you're using a stem cell or an exosome, which is a byproduct of stem cells, we're typically in the United States, we're talking about multipotent mesenchymal umbilical cord stem cells, and these are extracted from a newborn baby, essentially, right? The full term, live, healthy birth. The mother donates the umbilical cord. That tissue is then processed to some extent. It's screened to make sure it's safe. Um, it's broken down, and then a specific portion of the umbilical cord is extracted, and that is Wharton's jelly. Wharton's jelly is basically that substance in between the two arteries in the vein found in the umbilical cord. So you'd imagine it's good for its compressibility, it's a little bit rigid, preventing kinking. So that substance is rich with mesenchymal stem cells. So that substance can be taken. Really, there's not millions of stem cells in these cords. They take what's there, they put it in a growing medium. A good company will use a human derived, growing medium, and they'll allow it to flourish, right? From there, they'll take those stem cells, vial them up, count them, put them in vials, etc. And when those cells are applied topically to the face in a microneedling procedure, for example, it's kind of like aerating a lawn, right? You're creating space for not only nutrient absorption, but room for growth, right? And they're going to increase things like collagen, elastin, from the fibroblast cells themselves. Now, when someone comes in with a more localized scar or sun damage, generally, sun damage generally will do a microneedling facial, but more generalized scar, I'll do a targeted injection of something like an exosome product, or even ozone gas. I've
Mhm.
had a lot of good results with ozone gas and scars because it helps to remodel the tissue. At the end of the day, even putting the needle itself will cause for the body's inflammatory response and then subsequent remodeling of tissues. Did I answer the
Interesting.
question? I'm sorry.
Yeah, you did great. I
Okay.
just want you to give me like a facelift with, your peptides and stem cells. Um, one of the things I really appreciate about you that I think people need to understand, because part of this our joint effort is giving people really great medical advice and finding the right person. So I know a lot of you don't live near Laguna, but hopefully you can go see Davis, or he could help us find someone in your area. But when we do PRP and stem cells, one of the hallmarks, the most important thing about doing that is doing it under diagnostic ultrasound.
Yeah,
And I know you do too.
totally.
That's
From day
why I
one.
love what you do. So could you talk a little bit about that and why that's so important and what that is for people who don't know?
Yeah, absolutely. So, diagnostic ultrasound is basically allowing the practitioner to have eyes on the inside. So it's emitting different frequencies or waves, I'm sorry, that are going to react with different densities differently, showing a different visual representation on the screen. So it allows me to see bone clearly versus muscle versus vasculature versus nerves, and be able to use the anatomy knowledge that I have to just more precisely get into that problem area and treat it better.
Yeah, it's awesome. I mean, you can see right inside the joint
Yeah.
and you can see exactly where you need to go instead of some of these guys close their eyes and just, stick the
Yeah,
needle in you.
and
Hope it goes in the right spot.
totally. Like, to be fair
Really.
though, for some of these like docs that have been practicing for 50, years, they feel it. You can feel as the needle goes in the different tissues that you might be going through. But for me, that I
Yeah.
want to know, I want to sleep well, and I want
Yeah.
to know that I'm delivering
Love
the
that.
best possible care for my
Mhm.
patient. Because if you're coming in, as you know, stem cells are not cheap. All of this stuff, it's all out
Yes.
of pocket, right?
Yep.
So when someone comes in and they trust me with their care, and I don't do every single thing in my power to make sure that we get the result that we're give it its best attempt to get that result, it would be hard for me to sleep well at night, to be honest.
Yeah. See, you're one in a million, Davis, really. I love that. And you're allowing people to really live their best life while they're here on the planet. I've always said, I don't really want to live to 100, but as long as I live, I want to live as healthy as I possibly can during that time.
Yeah, I want the my end of life and my end of health to be damn near right next to each other.
Really good.
You know?
um, I know that some of these there's a lot of studies going on. There's a lot of some data, a lot of research going on. I know that these aren't FDA approved
Mhm.
for certain things. So can you talk about that and how we can use them until and on what and who and until
Yeah.
they get more approved?
I'll just give you like a simplified, version, not get into all the specific names of all these different things, but you're absolutely right. Right now, most peptides are not FDA approved, meaning that you can't get them through insurance, or some you can. But for the most part, the way that we're talking about using them, you're not going to be able to get them through a pharmacy, essentially. There is a gray area that people are working within, and that's essentially where I'm getting my access to these peptides and my patients, that is. And there's a way that you can you can just work it out with the state in which your type of business entity can produce a research and development product. Now this is where things get a little fishy, and I've been practicing for several years now, but it wasn't until very recently that I've implemented peptides into my practice. And it wasn't because I didn't believe in them, it was because I was unsure of the source, right? Where were these peptides, the raw ingredients coming from? Where were they being made? Who was handling them? What was the machinery? What type of protocols did they have? All of these things were, for the most part, unaccessible for the layperson, right? You just can't really go and ask these correct questions directly to a supplier. And if you're buying these online, you and I could go down to City Hall right now and pay 200 bucks and get the license or get approved. And then we'll go to your garage and we'll get all the ingredients. Let's say we have them. We could start making peptides. We could,
Well,
right? And that simple fact is what made me very nervous, right?
hmm.
Because I'm all about results. I want to make sure that my patients are getting good results and they're safe. Safety is key. It's crucial. It's everything. So I did
So
my due
you found a lab that you
Yeah,
trust,
I've
that it's
I've gone
quality and they're
vetted, correct.
producing what they say they're producing?
Yes, I've been there, I've seen it, I've seen the invoices, like, I put these companies through the ringer, because I wanted to make sure that this was going to be okay.
Yeah.
So I've probably gone through maybe 15 or close to 20 different companies that sell peptides and just, asked them all the same questions, gathered as much data as I could. And the reason that I ended up choosing my current supplier is one, which was very interesting, is they don't sell to the consumer. They only sell to doctors. They only will sell to medical practices. I like that. That
Mhm.
tells me that they're working with people who are educated and they're not scared of answering the questions that a doctor would ask. They also source all of their raw materials from either the United States or Europe. Of course, there's always bad players in every country, but typically when things are sourced from China, we can not typically, I hate to say that, but there's a higher chance that it's not to the same concentration at the very least that they say it is. And the processes, the protocols they use may not be up to the same standards that other countries like the United States would have, right? So that was also very important.
Yeah. See, that's so important that you're using the right products, because I've seen more not good products than good.
Me
Could
too.
you tell everybody what to stay away from? Like I said, I've seen these multi-level marketing, vitamins and stuff. Like, is there,
Yeah.
um, what should they not spend their money on because they're
If
not
there's
buying
a
what they
peptide that's like 80 bucks, or like a hundred, it's just low. There's a reason that
okay?
typically, at the end of the day, a lot of these companies are just concerned about the margins. And that was one thing about like the supplier that I use, that it's one of the first questions I asked: why are you in business? Right. And if your answer isn't somewhere along the lines of I'm trying to help out my fellow man, and to me, that's a red flag. Right, because those are the people that I like to work with, and I can feel safe knowing that my network filled with people like that will lead to, better patient care. So price, I mean, I hate to say it, but like things sourced from out of the country, there's so many online peptide companies. I wouldn't do it. I wouldn't.
I mean, if you're going to do it, if you're going to, I always say, like physical therapy, a doctor sends you to physical therapy and sends you to not a great place. And they spend 5 minutes with you and shove you off and do this and do that. And they come back and they say, well, doc, I did that. It didn't work. He can't make an informed decision. So it's just like you, like if somebody says, well, I'm going to try these peptides out of this bottle I got from this guy off the street. Well, and then he goes, you can go back and say, well, doc, those peptides don't work. It's nobody can make a good decision then on what's happening in your body, or, the next thing to do.
Yeah, no,
Yeah.
it's so true. And again, that's why it's so nice working with a practitioner, because like for me, I have cases on cases on cases of all kinds of different patients that have come through my door that I've used protocol A, protocol B, protocol C, and I can see the patterns. There's so much benefit to engaging someone like myself to help you better utilize the tools you have.
Absolutely. They have to work with somebody who's good. That's why we're talking. Um, can you give us just a few quick patient examples of somebody who might have been really sick or really challenging problem? I know a lot of problems start in the gut, and I know that peptides are really great for that. So any type of example you want to give that
Yeah, totally. I'll give you
maybe
one
because we
from.
have people, and maybe what we'll do in subsequent podcasts, we'll have you on and let just people ask you questions.
Yeah, that's a great idea. Yeah,
Yeah.
more than happy to do that. Um, I'll give you an example from this morning. I had a gentleman who
Wow. It
yeah,
took you so long.
yeah, I mean, I could just go through the last couple of days, but I had a gentleman who came in who had a partial tear of the distal bicep tendon. So it's basically like around this area, your biceps comes down and it attaches near um, where the humerus, radius, ulnar, joint is, the elbow. And he had a partial tear. And, he had not an MRI done yet. Knowing that it's a partial tear, you got a couple options. One is obviously surgery, two is let it heal. So he had already told me, I kind of just want to let it heal. And in that case, kind of what we were talking about earlier, quelling inflammation as quickly as you can is very important for the healing process. You don't want to lead to degeneration, which typically happens in a chronic inflammatory state. So we use the Wolverine, which is the BPC 157, KPV, and TB4. And 3 hours later, he called me back and was like, "Oh my God, my arm feels so much better." From a pain perspective, he felt he could rotate the arm a little bit better, which I advised him immediately, like, don't do that. You need to heal. But it
Rest.
just went to show, like, wow, there is this immediate change in presentation of his injury. Um,
What about people who have systemic problems, internal organ problems?
Absolutely, that's gut gut with Wolverine is really fantastic. I've had patients who have come in with digestive issues in the past. I put them through the ringer, right? We do the diet, the all of the things, diet, maybe an elimination diet, etc. But lately, I've just, because I've developed such faith in this peptide, I typically start them on this. And the patient that's coming to mind, she had been having like a lot of bloating, not blood in the stool, but irregularity to say the least. A lot of inflammation was going on, and she also had a little bit of an anxiety picture. Right? She, even in our visit, I could tell that she was very preoccupied with other thoughts. And we started the BPC Wolverine protocol, and within 3 weeks, her gut inflammation was down. She had dropped weight because a lot of her weight was inflammation based, and her anxiety improved. Right, so it
Wow.
really shows that direct connection between the brain and the gut. In fact,
Yeah.
most of, like, serotonin production is primarily made in the gut, and that's our feel good hormone, right?
Yeah, for
So
sure.
when you have an imbalance in your gut and it has an inability to do what it needs to do efficiently, your brain's gonna also suffer. Your whole organ, your whole
Yeah.
body will feel the
And,
effects of that.
and I know it can help you sleep. And so when you sleep, you heal. Healing occurs. So the better sleep we can all get, which becomes a challenge, I think, as time goes by. That's a boy. If someone tells me if I could sleep all night, I'd solve a lot of my
Yeah.
problems. I know we've gone on, and I know a lot of people have a short attention span, but if you could tell people a few last thoughts on maybe something we haven't covered or whatnot that you really want them to know about peptides and that you think is the most important, and then I'm going to talk about how we can find you.
Yeah, sure. I really think peptides are the future. I've just seen it help so many people in a variety of different ways. If you're having some sort of issue, whether that's like brain fog, fatigue, eh, oh, eh, so many things under the sun, that can be handled with peptides, I'd implore you to start researching them. Go on ChatGPT and start looking it up and getting an understanding of maybe what peptide could be right for you, and then reach out to someone like myself and engage that.
Yeah, for
right?
sure.
I really believe in the intuition of the person. You know, so many times I'll rely on that over sometimes maybe what imaging will say, for example, to treat them.
Yeah,
Because you know your body more than anyone, and if you have an intuitive feeling like, oh, this might be what I'm looking for, right? I would try it. You know,
yeah,
no stone left unturned.
yeah, yeah. Trust your gut, like we just
Yeah,
and your gut and healthier gut. How can people find you, Davis?
yeah, absolutely. So I
What,
have a I have a clinic here in Laguna Beach, as we said, called Ashara Health and Wellness. We do telehealth visits, which I think would be probably most appropriate unless you're in the area. I know a lot of your base is in Southern California as well. But our website is ashara.health, not com, but ashara.health.
how do you spell Ashara?
Yeah, ASHARA dot health.
Okay, so make
And
sure we get it right for people.
yeah, and
Put it in the show notes too, but
if you mention that you heard about us through this podcast, I'm more than happy to do a complimentary consultation for you and your patients. I think that would
wow,
be,
that's nice.
yeah, of
Well,
course.
and doing telehealth or telemedicine today is so easy and acceptable to people since 2020. So I would, if I did not live near you, I would still want to see you and do it that way.
Yeah, we have an awesome clinic here. We're actually about to move to Newport soon, but we've got hyperbarics. We have an ozone machine, like we've been talking about, stem cells and peptides. I have a women's health specialist, an acupuncturist.
Nice.
We really, I tried to just make it a one-stop health shop. Most people come and spend 2-3 hours here just hanging out and getting healthy. And that was the vision.
You must you must serve something good. Well, I
Depends who
think
you ask.
I think we can go on and on because I know I've talked to you too about some other things you do in your practice with acupuncture and some other things. So I think we're going to have to do this again. But
Wonderful.
I
I'd love
really wanted to cover peptides because I've just heard so many wrong things and people not using them appropriately. I want to talk to somebody really great like you that's honest and ethical and will give you the truth about them. But I think we're going to have to do this again because there's a whole lot more to talk about.
It really is. We
Yeah,
could spend a podcast on each peptide, to be
right,
honest.
right.
Mhm.
So what we'll do is we'll let people absorb all this, and then we'll schedule another time where we can talk a little bit about them. We'll do a live, and people can pop on and ask you some questions if that's okay with you. It's very generous of you, but I'm so grateful to have met you through your dad,
Yeah,
because pickleball nut,
pickleball.
um, because I was getting so discouraged. And I thought, I got to find somebody who's really good. So I thank you again for
You're
taking
so
the
welcome.
time
Thank
and
you.
educating us and being such a good, caring doctor. We're so aligned that way. And I knew this would be fabulous. So appreciate all the information. We'll put how to find you in the notes. And we'll also, I answer all the comments on our podcast. So when people say, wait, I'm not sure how to find him, or I'm not sure about this, I may be sending some of those questions over to you.
No problem. No
All right.
problem.
Well, thank you, Davis. You take
You're
care,
so
and
welcome. Thank
I'll
you.
talk to you soon. Thank you for joining our podcast. We'll have a brand new podcast next week for you to join in with us. Thanks for tuning in.